vaping and electronic cigarette use is an emerging public health issue, especially amongst our youth and adolescents, particularly the high school age students. Electronic cigarettes are very popular amongst that group. Some products look like flash drives. They're very small, can be held in a student's hand and secured from the teachers. They come in fruity flavors, so they're very attractive. But what's important is that the use of electronic cigarettes imparts nicotine and other addictive substances that can have an effect on brain chemistry and brain development. So in those very important adolescent years when a child's brain is developing, these compounds can have very negative impacts.
And that's something from a public health perspective, because you really don't know what's in a lot of these products, and that's what makes it a little more scary.
Absolutely, and it's not clear what's in all these products, and that's the reason we see the FDA taking a closer look at electronic cigarettes and really holding them to a higher caliber, but we're not there yet as a country. So I'm very concerned about the use of electronic cigarettes, and I encourage all parents, educators, and community members to join me in making sure that our teens and youth are aware of the risk of electronic cigarettes and doing as much as we can to prevent the use of electronic cigarettes in this population.
So there's various different color cartridges. What are those different cartridges?
Those are different flavors. This is tobacco, that's creme brulee, that is mango, and that's mint. Each one of those pods holds as much nicotine as a package of cigarettes. Also of interest, among youth who use e-cigarettes, 1/3 have used an e-cigarette to vape marijuana. We have a real problem with e-cigarettes right now, especially among our young people. We know that e-cigarette use has almost doubled between 2017 and 2018 nationally, and that's really reporting what we're hearing from schools and communities. Schools are saying their kids are using them in the classrooms, they're using them in the hallways, they're using them during games. It's just everywhere. It's really exploded. And what we do know is young people are attracted to the flavors. Like, that's really why they start using the products. And then once they try the flavors, they get the nicotine hit, and they don't realize that most products contain nicotine. So they come because it tastes good, and they stay because it's addictive.
So what can be done? What are next steps?
You know, we've been down this road before with regular cigarettes, so really we need to use the same playbook for e-cigarettes. We need to include e-cigarettes in smoke-free policies. We need to include e-cigarettes in tobacco-free school policies. And we need just basic education, both for adults and parents as well as for young people, so they really understand the risks.
The Surgeon General's advisory is pretty rare. Does that elevate the game, so to speak?
It really does. This is an advisory from the Surgeon General. This is on par with mothers drinking during pregnancy. I mean, that's the Surgeon General's advisory. And the Surgeon General has declared youth use of e-cigarettes as an epidemic. So we're really going to see some resources and some collaboration at the federal government level. But as communities, we really need to come together and address this as well.